most strokes and most heart attacks are caused by a disease called atherosclerosis, which is the buildup of plaque in the artery. If the artery is the carotid artery in your neck, then you're at risk of getting a stroke. The immune system is very active in the plaque. Many immune cells are in the plaque, many types of flavors of immune cells. And the reason that they go there is because atherosclerosis is associated with an autoimmune response. You can think of inflammation as the executor and the immune system as the instructor. So think of a military unit and a general directing everything. That's the immune system. But the foot soldiers are the inflammatory cells. So it could be a type of cells called neutrophils, it could be a type of cells called monocytes. But inflammation is ultimately what causes the problem, because the inflammation in the plaque can cause the plaque to rupture. If the plaque ruptures, you get a thrombosis, which is a blood clot in that blood vessel. If you have that blood clot in that blood vessel, no blood is flowing to half of your brain and you have a stroke.
Carotid endarterectomy is a surgical procedure that removes plaque from the carotid bifurcation that sits in the neck for patients who may be at risk of having a stroke or had a prior stroke. And we remove that plaque by separating layers of the artery that we can remove and then keep it open so it can restore blood flow and prevent the embolization problem of a stroke. Most carotid artery stenosis is related to atherosclerosis, big long fancy term for hardening of the arteries. And it tends to happen in all of us as we age. We get more birthdays and we get more carotid plaque. There can be other risk factors, including things like high cholesterol, smoking, high blood pressure. The bigger problem that we've identified is when the plaque embolizes, or when small elements of the plaque can break from that segment in the neck and then travel north into the brain and create a stroke.
One treatment for atherosclerotic plaque in the carotid artery is to take out the plaque. Because you cut something out, you have material to study. And it's not a mouse model, it's the actual human disease. What we also do, we get matched blood. That means blood from the same person, usually taken about a day before the surgery. And then we can ask which of these cells are found in the blood that also found in the plaque. If we find certain cells that are indicative, we call them visitors. So cells that can visit the plaque and then maybe go back into the blood. That's very valuable information, because if you can find the markers, you can study them, you can see how bad it is, maybe how to make it better.
So the research partnership is vital, helping with this. Right now, our estimate on one's risk of stroke is based upon the degree of stenosis. Frankly, that's a relatively crude measure on what we have today, because some plaques embolize and some stay dormant. We're not very good on predicting that. So when I think about the research advantages, having an expert like Dr. Ley, who brings his immunology expertise, I think that's a great advantage for us, because we can sample both the blood from the patient and the plaque at the same time. That's then analyzed and helps us match what someone's immunologic characteristics are relative to the plaque, and we can figure out who's at risk for stroke and who can be better treated with medical therapy.